the healthcare presence in support of both our patients who are having home care, including my late father, who had a stroke and received wonderful home care from his home care attendants for several years before he passed. And also supporting the health of the home care workers and their families. Now, let me explain. There's been a lot of misunderstanding, a lot of excuses given for not doing this. So let me explain what's going on here, okay? Folks are being told that they have a quote-unquote 24-hour shift to work because the person in need of home care support needs to have somebody there 24 hours. And then they turn around and they tell the workers, oh, we're just going to pay you for 13 hours. So right away, I'm thinking, oh, that's got to be wage theft, right? I mean, that can't be right. And then they're saying, well, okay, so it's not really a 24-hour shift. We're paying you for 13 hours. So those other hours, the other 11 hours, you don't have to take care of the person. But you have to be there, and you can't go home. But the person needs care, but we're not going to pay you for those other hours, and you don't really have to take care of them, but you're there anyway, so of course you are going to take care of them.
Make it make sense!
So, well, I can't make that make sense because it doesn't make sense. It ain't right.
It ain't right.
That ain't right. So the person who needs the home care needs the home care. Maybe you could do a 12-hour shift and actually work the 12 hours and be paid for the 12 hours. Or you could do 3 8-hour shifts. There's a logic to any of these things. A 24-hour shift is not good for the person receiving the care. It's not good for the person giving the care. You know, years ago, when as a physician, I know what, residents, trainees used to undergo, and there was all this pride in having these 24-hour shifts, these 36-hour shifts. And what we learned is it's bad for healthcare. It's bad for trainees, and it was actually made illegal. There was a thing called the Libby Zion Law that forbade these kinds of abuse of hours in healthcare workers, although that only applied to physicians. So for the home care workers, this is just absolutely makes no sense. Now, we're also being told, oh, gee, we should fix it at the state level. Fine, so fix it at the state level. But as we've heard, this is principally going on in New York City. And we know that New York City can change laws for the areas within its boundaries. We know, for example, that we applied the general worker protections a couple of years ago for persons working in homes. We no longer had the exemption of home care work not being covered by the same civil rights as other workers, and that was passed at the New York City level. So there's no good reason that it can't be done at the city level, but if you want to say, oh, it's state Medicaid and we have to change state Medicaid, let's do it in the state level, fine, then do it now at the state level, or do it now at the city level. Either way, it's absurd and obscene.
Yeah!
Now, it's part of a greater problem, as we've heard. It's part of a greater problem of how we do Medicaid in New York State. The vast majority of these home care workers that's involved in this situation are through the managed Medicaid system. New York State, in some ways, has a very good Medicaid system in terms of the breadth of coverage and who's eligible. But it has an absolutely insane, worst in the country, managed Medicaid system where we have about 24 for-profit Medicaid managed care companies around New York State. Any given county will have anywhere from 2 or 3 to up to 15 different managed Medicaid companies. Each one has to make their profit, and then they're passing on some money through the through the managed insurance company to the home care agency that then is passing the money on to the actual workers. So every time you add additional unnecessary administrative for-profit company layer, you've got more and more of the taxpayers' money that's being eaten up by unnecessary middlemen and not going to the care workers on the front lines. So there's a lot of work to be done in fixing managed Medicaid generally, And what we really need, of course, is the New York Health Act, which would be comprehensive medical care, dental care, mental health care, and long-term care written into the legislation, providing comprehensive, universal for all persons in New York access to long-term care at home where possible and in nursing homes where necessary. Comprehensive care, comprehensive coverage for this at a lower cost to the taxpayer in a more efficient manner for all persons living in New York to receive services and all the persons who are providing those services to be paid fairly. So we say now, no more 24 today, no more 24 today, no more 24 today, and fix managed Medicaid statewide and pass the New York Health Act so we can all get the care and dignity that we deserve. Thank you very much.
好，这个是来自这个纽约医生的这个会，他们呢在这个绝食期间呢，也负责了一直呢在监管我们这些绝食者的这个健康。但同时呢，也呢今天来发言，因为呢这个24小时工作日呢，他知道非常的不人道。他的老爸呢以前呢也是接受这个护理、家庭护理的这个看护的。当他知道这个时候，他当然就很明显就问：哦，这个是怎么回事？他就听到，哎呀，只给13小时工资啊。他说这个13小时工资呢，意思就是说，哦，你晚上可以不用照顾病人，但是你晚上不能照顾病人，你又不能走，你又在那里，病人有什么事呢？你又要起来去照顾他。